Hey everyone, and welcome. We will get started right at 11 o'clock. Hi, everyone, and welcome to this session. My name is Emily Shattuck, and I will be the monitor for today's session. I'd like to introduce you, Carmen Good. Carmen, take it away. Thank you.
Thank you, Emily. Hi, everybody. My name is Carmen Good. I am a local licensed agent with Medicare. My agency is called H.O.P.E, and that stands for Healthcare Options Providing Educated Solutions. With Medicare, education is key. So we really are committed to assisting people eligible for Medicare on education. And, we just want everybody to be empowered and knowledgeable about what Medicare is and how you can find all of the options that are available. So I'm going to go ahead and share my screen and go over this presentation. At the end of the presentation, we are going to be doing question and answer. So if you do have questions as you are, as we're going through the presentation, please just put them in the Q&A. Okay, so the very first thing that I would like to do is show you this little video.
Thanks for the Medicare. For Blue Cross and Blue Shield. For a hip that finally healed. Remember, on prescriptions, generic is a steal. We thank you so much. Okay, what do you think now? Don't hold back. I can take the criticism.
Awful.
Stinky. Go to hell, all of you.
Oh, I hope you guys enjoyed a little laugh for the morning. Anyway, we are going to go on a little journey, learning about Medicare, learning how the end result is learning how to choose a plan that's going to be right for you. There's going to be some questions to think about along the way. I'm going to talk about Medicare eligibility and the enrollment periods, and then also about all of the different options that are available to you. Okay, so again, I am a local licensed agent, and we like to meet with people on an individual basis so that we can educate you, find out what your needs are, and just help guide you through this whole process. Because what we would like to do is to make sure that you have a plan that's going to work for you. So some of the things to think about as we're going through this Medicare journey is you need to consider all of your healthcare needs. In addition to your healthcare, we need to think about cost. What is this going to cost you? What's going to be your out-of-pocket? And then what other coverages do you need in addition to just medical or hospital coverage? Do you need coverages like dental, vision, hearing, some of these other things? And then just to have the confidence and the peace of mind that you have a plan that's going to be exactly what you need. So that's one of the main topics that's going to be really, really important today. So some of the questions that we go through is what type of prescription coverage do you need? Do you not take any prescription medications, or do you take some? And then we make sure that those are how they're covered in the different formularies with the different carriers. So we do customize all of that, again, just to make sure that we are covering everything that is important to you. We do look at the provider network. So do you need a network that's going to be at the national level, or will a smaller local network provide what you need? So we look at things like that too. Again, looking at benefits, the dental, the vision, the hearing, the over-the-counter items. If these things are important to you, then we help you find a plan that include all of these items. And then what does the out-of-pocket cost look like? What are the co-pays? What are the deductibles for the medical services that you may need? And then again, for coverage out of state, and we'll go into that a little bit more later on in the presentation. So what type of insurance do you have now? Are you not eligible for Medicare yet? Are you on a marketplace or an individual plan and getting ready to age in? We can help you with that. Do you have employer group coverage? Are you still working? So if you're Medicare eligible and you're still working, do you need to apply for Medicare at age 65? We can talk about that too. Retiree coverage, there's a lot of big corporations here that offer retiree benefits. If you worked for the city or the county or the state, there are retiree benefits that they offer. And then are those working for you? Are they getting too expensive? Things like that. Or are you already on an existing Medicare plan? And if you are, how is that still working for you? And have you done an annual Medicare review? A Medicare review is really important to do because, especially now for 2022, there have been a number of changes in some of the plans where things to look at are, did your co-pays go up? Did benefits go down? Is your doctor still in the network? Are your prescriptions still covered as they were in the previous year? Is your pharmacy still considered a preferred pharmacy? There is a big cost difference if you use a preferred pharmacy versus a standard pharmacy, and also versus a mail order pharmacy. So it's important to look at those, look at the costs and look at the benefits, and make sure that if you do have an existing plan, that it's still going to work for you into the next year. Another reason why it's really important to do a Medicare review is because our health changes. Over time, our health changes, and the coverage that I have, is that still adequate for my needs? So then the next set of questions are, do you have Medicare Part A and Part B yet? So some people, yes, I have both. Some people only have Part A, and people who only have Part A, if they have already turned 65, they may have what they call credible coverage through their employer. And if you do have that, then you do not need to apply for Medicare at age 65, as long as you have credible coverage. A lot of people are working later. A lot of my clients are working till age 67. Some of them have a goal of working to age 70. So if they do have employer benefits, then you can wait to apply for your Part B until you know that that coverage is going to end. And then I would encourage you to apply for Part B 3 months prior to when you know that that coverage will end. That way there won't be any gap in coverage from your group plan to your Medicare plan. So I like to plan as early as we can ahead of time so that we don't want anybody to not have coverage. And there's some people who don't have either yet. They're just kind of trying to learn about Medicare, what is Medicare, and when am I eligible for it, and how do I enroll? So those are some of the things that we're going to cover next. Okay, so let's talk about the eligibility and the enrollment periods. So you're eligible for Medicare when you turn 65, or if you have been diagnosed with a disability for at least 24 months, then you're eligible for Medicare at any age. Also, if you have end-stage renal disease, then you are also eligible for Medicare at any age. And the way that we've paid into Medicare over time is by working at least 10 years or 40 quarters and paid into Social Security through payroll taxes. And in doing that, we are eligible for Medicare Part A. So over those 10 years or 40 quarters that we've worked, we've already paid for our Part A coverage. You also have to be a permanent resident of the United States or a legal citizen who has been living in the United States for at least 5 years in a row. So that is the eligibility criteria to have Medicare. So now let's look at the enrollment periods. So you can first sign up for Medicare 3 months prior to your 65th birthday. So if your birthday is in December, for example, you can go back 3 months. So starting in September, you can apply for Medicare. And then your Medicare would be eligible on the first day of your birth month. So things are taking a little bit longer now to go through the process. So I do encourage everybody to apply as early as you're allowed, which is 3 months prior to your birthday. So you do have a total of 7 months for your initial enrollment period. So if you enroll, if your birthday is in December and you enroll in September or October, then your Medicare would be effective December 1st. If you wait till after you turn 65, so if you don't apply for your Medicare until January, then your Medicare won't take effect until February. And then if you don't apply until February, then your Medicare won't take effect until March. Okay, so so you either stay ahead of it or you're going to get behind it. If you miss your initial enrollment period, so again, you have 3 months prior to your birth month, you have your birth month, and then you have 3 months following. So 7 months total to apply for Medicare. If you miss those 7 months, then Medicare has what they call a general enrollment period. The general enrollment period runs from January 1st until March 31st. However, the coverage will not start until July 1st. Okay, so there is going to be a gap in coverage there. So that's another reason why I do like to encourage people to apply as early as possible. And the other reason is because right now, a lot of the baby boomers are aging into Medicare. And the numbers show that there is approximately 11,000 people a day turning 65. So there are a lot of people that are going through the Medicare enrollment process. So that's another reason to start as early as you can, because that volume is pretty high. So right now we are in the annual election period. The annual election period runs every single year from October 15th through December 7th. And this is the time of year where people can add a plan, they can drop a plan, go back to original Medicare, or they can switch plans during this time. So any changes made during the annual election period will have a coverage date starting on January 1st of 2022. There are special enrollment periods, and these are for life events. So if you move outside of your coverage area, for example, if you've moved from California or even Colorado into New Mexico, and the plan that you had at home, you don't have coverage here in New Mexico, then that creates a special enrollment period where you can meet with a licensed agent, you can find out the plans that are available in your zip code, and we can help you find one that's going to fit your needs. And then if you enroll, we'll say if you moved into New Mexico now in November, we can help you find a plan that would have a December 1st start date. So there's that. Moving, if you are losing other coverage, and that also falls into if you say you're 67 years old and you know that you're going to retire at the end of the calendar year, you can have a special enrollment period if you are losing that insurance coverage to get onto Medicare too. So there's another, that can be a whole training session in itself, but if you do have questions about that, please put them in the Q&A and we'll definitely address that at the end of the presentation. Okay, so now what we're going to do, we're going to spend a little bit more time here and we're going to learn about our Medicare options that we have. So what is Medicare? What is original Medicare? So original Medicare consists of Part A, which covers the hospital, and Part B that covers the medical side. So Part A, again, was paid for by working 10 years or 40 quarters. And Part A covers the hospital stay, skilled nursing facilities, hospice care, and some home health care. So the Part B is the medical coverage. The medical coverage covers your doctors, your specialists, your imaging, your x-rays, your durable medical equipment, your lab work, and your preventative services. So the way that original Medicare works is, again, Part A has been paid for, so there's not going to be an additional premium for that. Part B has a premium. So currently for 2021, the premium for Part B is $148.50. We have not heard yet what that amount is going to be for 2022, but we are hoping that that amount, or that dollar amount, will be released within the next week or two. It's typically around the second or third week of November when that information is released. So Part B premium again is $148.50. The way original Medicare works is there is no network, which means that you can go to any doctor anywhere in the country as long as that medical provider or that medical facility accepts Medicare. So you're not tied to a specific network group. You can go anywhere that you need to go. And then so that the coverage is an 80-20 split with the government. So the government will pay 80% of your healthcare costs, and you as the Medicare beneficiary are responsible for the 20% of that cost. So that is original Medicare. So these are some of the healthcare items that are not covered by original Medicare. So original Medicare does not cover prescription drugs. So you would add a prescription drug plan to original Medicare. Prescription drug plans range anywhere between $7 a month up to $80 a month. And again, that's going to depend on what your needs are. For people who do not take prescriptions, you know, they don't want to pay a lot out of pocket for a monthly premium for something they don't need or will use. Other people need a prescription drug plan to help cover that cost of those prescriptions. Original Medicare does not cover dental, vision, hearing, or extended long-term care. So those are other supplemental benefits that can be added in addition to a prescription drug plan. So there are 3 ways that we can take our Medicare. Okay, so we've already talked about the first way, and that is with original Medicare. And again, original Medicare is an 80-20 split. So then the other choices are to have a Medicare Supplement plan. And we'll go into that into the next slide. So if you do get a Medicare Supplement plan, you still need to add a prescription drug plan to that. So with the Medicare Supplement plan, you will have original Medicare, you'll have the supplement, and a prescription drug plan. The third way that you can take Medicare is a Medicare Advantage plan. Many of the Medicare Advantage plans do have premiums that are as low as $0. Some are a low dollar premium. And we'll get into that a little bit more as we go through the slides. Okay, so what is a Medicare supplement? A Medicare supplement helps fill the gaps of original Medicare. So remember, I had mentioned that original Medicare is an 80-20 split. So what the supplement does is it covers that 20%. A Medicare supplement does have a monthly premium. The monthly premiums range from about $100 to, we'll say, about $140 a month. Then you would add a prescription drug plan to that. And then keep in mind that this still does not cover the dental, vision, and other extra benefits like that, but it will cover all of your medical needs. And again, with original Medicare and adding a supplement, there is absolutely no network. You could go anywhere in the country as long as they accept Medicare. So there's no network. So let me cover that. Go to the next one. So then let's talk a little bit about the prescription drug plan, also known as the Part D. So these plans are offered by a private insurance company. The premiums around, again, a prescription drug plan range as low as $7 a month and up to $80 a month. Each of these plans have a different formulary, and a formulary is a list of the medications that insurance company covers. And the prescription drugs themselves are covered at different tier levels. So there's tiers 1. Some plans have tiers 1 through 6. Some have tiers 1 through 5. Now going into 2022, many of the plans that where you use, if you're going to use a generic medication, many of those going into 2022 for tier 1 and tier 2 are going to be a $0 copay on those. There is, again, a monthly premium as well as deductible and copayments. Many standalone prescription drug plans do have a deductible, and currently for 2021, that deductible is $445, which means that you would pay the first $445 before the insurance company kicks in to help pay for the prescriptions. There may be a penalty if you do not enroll in a prescription drug plan when you're first eligible. But again, that is not the case if you're still working and if you have credible coverage and you have prescription drug coverage, then you can sign up for that when you know that coverage is going to end. Also, there is extra help available. And this is for people who have limited income and resources. So the extra help is offered by Social Security. And you can log on to your Social Security account and you can apply for extra help. Extra help is determined, again, on your income and resources. So there's 4 different levels of coverage. There's 100% coverage where that extra help will cover the cost of the premium, deductibles, and copayments. There's 75%, a 50%, and a 25%. So it, on a 25% basis. So depending on where you fall, they can give you that extra help to pay toward that if that's something that you need. And we can discuss that also in the Q&A if you do have specific questions about that. Okay, so then the third way to take your Medicare. So remember, the first one is original Medicare. The second way is to add a Medicare supplement to original Medicare with a prescription drug plan. And then the third way is a Medicare Advantage plan. These are also known as a Part C. And I'm sure you guys are probably tired of seeing all these commercials on TV. But let me kind of walk you through and we can kind of compare what the differences are with those. So the Medicare Advantage the Medicare Advantage plan is considered, again, the Part C, and it's an all-inclusive plan, and it has everything that original Medicare is in this plan, as well as a prescription drug plan, and many of these extra supplemental benefits, such as dental, vision, hearing, transportation, over the counter. There's a bunch of different things that are bundled in to these Medicare Advantage plans. So let me explain what the difference is between having original Medicare and a supplement and having a Medicare Advantage plan. So the Medicare supplement does have a monthly premium. So you can think about that as you're paying ahead just in case something happens, because the supplement will cover that 20% that original Medicare doesn't cover. So then after you pay, I think it's $203 deductible for a supplement, then you will have no cost out of pocket for your medical care. With a Medicare Advantage plan, a Part C plan, they do have either a $0 or low dollar premium, and you would pay co-payments or co-insurance as you use the plan. So the way that I think about it is you can pay ahead in case you need it, or you can pay as you go. And depending on your health, we can kind of determine which one of these would be would work better for your needs at that time. The other thing that I did want to mention too is when you do have original Medicare, you'll have your Medicare ID, you'll have your prescription drug card, and then you'll also have your supplement card. So you can have up to 3 cards if you go that route. When you have a Medicare Advantage plan, you only have 1 card, because everything under original Medicare is included here. Your Part D prescription drug plan is included in here, as well as what the plan itself has. So just something to consider there. So then we'll look at other benefits that the Medicare Advantage plans include at no additional costs. So the Medicare Advantage plan is designed to keep people healthy. So they do include benefits in there that are going to assist you in that, such as your dental, vision, hearing. Many of them have visits with licensed therapists, and that's for your overall well-being. Some of them, the next group is to stay healthy and active. Especially now during COVID, I think every single plan now has online doctor visits that you can do from your cell phone or from your computer, if you don't want to go into the doctor's office. Many of those now are offered at a $0 copay. Many of the plans do offer a 24-hour nurse hotline. And that's, if you wake up in the middle of the night and you just don't feel good, but you don't necessarily want to drive to urgent care or to an emergency room, you can call the nurse hotline and describe what's going on. And then they can recommend, yes, I think you need to get seen, or, you can try this home remedy and see if this will, help you get through that health issue that's happening at that time. The other thing that they do offer, and that's very popular, is the Silver Sneakers or other fitness program. The Silver Sneakers program will pay for a gym membership for you. I know many people still are not comfortable going to the gym. So if you do call your fitness program benefit, whether it's Silver Sneakers or Silver and Fit or one of the others, if you call them and just let them know, I'm not comfortable going to the gym, can you send me a kit? They will send you a kit to your home so that you can continue exercising at home. They also provide a lot of online classes where, just to keep moving, if you like to do stretching, yoga, things like that, they have some great classes online that will help you with that. Many of the plans do offer transportation, which will take you to and from doctor's appointments. Some of the plans do offer in-home support, and some offer care coordinators. So if you have just had surgery and you need to see other specialists and need to coordinate physical therapy and occupational therapy and those type of things, the care coordinators help you do all of that, just to kind of lighten your load so that way you can recover and not have to worry about those things. And then the last category is where they help you save money. So, you know, there are $0 or very low copays for prescriptions if you're taking the generic prescriptions. And then many of the plans do offer some level of over-the-counter benefits where you can either order online, you can call in an order, or many of them now are sending debit cards to you where you can go and pick up those items at a Walmart or at a CVS. And those items for the over-the-counter, you know, they include things like vitamins and supplements, allergy and cold medications, first aid, toothpaste. I mean, there's all kinds of things in there that many of us use on a daily basis. So those are just there to help you save money on things that you would spend your money on anyway. Okay, so then step 4 is choose a plan that's right for you. So again, we're going to just go over this again really quickly. So original Medicare is an 80-20 split where they will cover the hospitals and your medical care. And then with original Medicare, you can add a prescription drug plan to that. Okay, the second way again is a Medicare supplement. The supplement is intended to cover that 20% that original Medicare does not cover. And then you would add a Part D prescription drug plan to that. So that's the second way. The third way is a Medicare Advantage plan, which has everything that original Medicare has, plus a lot of extra benefits. Again, Medicare Advantage has a low dollar or a $0 premium, but then it's inclusive of your Part D prescription drug plan and has other coverages there. So, you know, we kind of work through that to try to find what is going to meet your healthcare situation and what is your financial out of pocket, right? Do you want to pay premiums or do you want to pay copays? And we can work through that and find what's going to work best for you. So, so this is kind of what we went through. When you work with a licensed independent agent, we do a lot of education. We listen to what your needs are. We go through all of the options that are available to you. We'll present a couple of them, and then you choose which one you feel is the best for you. We assist in the application process. And then once it's submitted, it goes to the carrier that you chose, whether it's a supplement or a Medicare Advantage plan. It gets reviewed by the insurance company, then it gets sent over to Medicare, and then they will review it. And once it's approved, they will send you a letter saying that it's been approved. Then you will receive your ID card, your evidence of coverage, and other welcome materials. I should have changed the 10 days because now with COVID, it's really taking anywhere between 2 to 4 weeks for your ID cards and your other materials to arrive. Many of the carriers do have a platform where you could go on as a member and you can set up a profile where you can look up doctors, you can look up what pharmacies are near you, you can manage your medications, you can review all of the extra benefits that plan offers. And then your plan will begin on the first day of the following month of eligibility. If you do enroll during the annual election period now, October 15th through December 7th, then the plan would take effect on January 1st. So that is my presentation. I thank all of you for visiting, and I would really like to be available to answer any questions that you might have.
So we did have one question come through. Actually, now we have two questions. So the first question is from Mary. She says, aren't Advantage plans restricted to a network of doctors? And aren't there issues with coverages for certain conditions if you change back from Advantage to Supplement?
Yes. Mary, thank you. That's a great question. So yes, with the Medicare Advantage plan, there are two different kinds of Medicare Advantage plans. So there's one that's called an HMO, which is a much smaller network. It's about this big, right? It's a local network. And the second one is a PPO, and that one is a much broader network. Many PPOs that are available here in our state, county, have what they call national reciprocity, which means if you need to see a specialist in another state, the chances of that plan having a specialist in network, we'll say in New York or in Colorado or California, you can find a doctor that is in network in that plan. And then one thing to keep in mind too is when you do have Medicare, you are covered in all 50 states. So if you like to travel, you are covered no matter what plan you have in case of an emergency or urgently needed care. And you are always treated as if you were in network. So the second part of your question of switching from a Medicare Advantage plan to a supplement. So that's a great question. So if you enroll in a Medicare supplement when you're first eligible for Medicare, then it's guaranteed issue, which means it does not go through any underwriting. But if you join a Medicare Advantage plan, say for your first couple of years, and if you are in good health, you can apply for a Medicare supplement, but it will go through underwriting. So if you're not in very good health and you move from, and you want to move from a Medicare Advantage plan to a supplement, the supplement can deny you. Or if they allow you to go into the supplement, the premium cost could be higher because it does go through underwriting and it is based on risk. So that's a great question. Did I answer your question, Mary?
I think she is muted. Or she says, yes, thank you. She does have one more question. She asks, how are dementia conditions being covered?
Dementia conditions are covered under the general health part of the Medicare plans, with the cognitive and all of that they're covered the same way.
So we have about 5 more minutes left of this session. If anybody has any more questions, you can leave them in the chat or the Q&A session.
Okay, well, I want to thank all of you very much for joining me today. And if you have any questions, again, my name is Carmen Good. My agency is H.O.P.E Solutions, and my phone number is at the bottom of the screen. So I just wanted to thank you again, and I hope you guys have an amazing day. This is a great conference, so I'm glad that you're all attending.
Thank you so much for joining us today, Carmen. We appreciate it, and thank you for joining our panel participants. If you have any questions, remember her contact information is on the slide. Thank you and have a great day.
Great. Thank you, everybody.